Benign prostatic hyperplasia, or the benign enlargement to the prostate, is exceedingly common. In fact, it becomes more common, more prevalent as they progress through life. Approximately 50 to 60% of men in their 60s will have prostatic enlargement, and around 80% of men in their 80s can have urinary issues related to an enlarged prostate. Hi, my name is Dr. Chabert. I'm a urologist and director of the Prostate Clinic located on the Gold Coast in Australia. In the following video, I wanted to highlight for you an alternative that you may be suitable for, an alternative for managing your urinary symptoms that doesn't include the standard historical way of either having a tablet or alternatively the TURP or the rebore operation if the medication fails. Please, if you get value from this video, considering subscribing to our channel, give the video a thumbs up. If you have any questions or comments, or if you've got experience that you'd like to share, please leave it in the comments section below. So this video is going to explore iTind. iTind is a relatively new procedure for the management of urinary symptoms. So what is the iTind procedure? In essence, it is a minimally invasive treatment choice to manage urinary issues. It involves the deployment of a small basket, a nitinol basket. Nitinol is a malleable metal. Now, the basket is then left in place. It is attached to a thread which is secured to the external aspect of the penis. Men can then go home. They're discharged same day. They do not have a catheter. And in essence, over the next 5 to 7 days, what we see is that there is a gradual compression and expansion of that basket such that it creates 3 channels within the prostate, and those channels, the body round about those channels begins to scar and holds those channels in place. Men then return usually 5 to 7 days after the insertion of that basket. The basket is then removed, and what men can experience from that point moving forward is an improvement in their flow. So flow goes up, and gradually with time, bladder symptoms such as rushing and frequency and getting up at night, they gradually settle down and improve. So what evidence do we have that this treatment is any good? Well, there are trials that demonstrate an approximate 45% improvement in their symptom scores, and they have an almost 50% improvement in their quality of life scores that are associated with that improvement in the way that they pee. You may have heard of other treatments such as Resume or Urolift. All of these treatments are minimally invasive treatments for managing urinary issues, and by and large, they produce a crudely similar improvement, a similar magnitude in improvement in the way that men pee. There is some early to medium term data demonstrating that the majority of men, some approximately 90% of men, are still happy with the improvement in their urinary function that is durable out to about 6.5 years following treatment. So what are the benefits to iTind? Well, one of the benefits is it's minimally invasive. We don't remove any tissue, so there is minimal risk in terms of bleeding. The main advantage to this is that there is negligible risk to sexual function, and sexual function basically includes erectile function and also ejaculatory function. The downside, if you like, is that it can be a little bit uncomfortable in that first week when the basket is in place. There's still the thread that is attached to that basket and fixed onto the external surface of the penis. When the basket comes out, there is relatively rapid symptom improvement, and as I said, that is durable. It's done in an outpatient setting, and another advantage really is that there are no permanent implants left in the patient. So that is in contrast, if you like, to a treatment such as Urolift. Okay, a little bit about the downsides. As I've mentioned, the thread that is attached onto the penis for that first week. Yes, you can have some blood in your urine, a little bit of stinging, burning, irritability. In that first week, men may find that they go more often, they get up at night more. So they do have this irritative situation that resolves once the basket has been removed. Look, if you have any questions, please leave them in the comments section below. If you have had an experience with this, or a friend or a family member has, and you're prepared to share it with us, please leave your story down below. Until the next video, take care of your prostate.